I wanted to share my thoughts about epidemiologists or epidemiology um, in regards to the coronavirus and the shutdowns. Um, so first thing, I haven't really understood the behavior of the epidemiologists in authority during this whole thing. It didn't make any sense to me that the epidemiologists waited so long um, to restrict travel from China. By the time we heard about it, it made sense to me that if this is a infectious viral respiratory disease, like most of them, it's probably already in the States. So I was thinking this back in January, February, just considering how much travel there is back and forth between the west coast of the United States and China. So wondering why there was so little response if there was a concern for danger. And then once there was a response, several months later, they were acting as though it were possible contain um, to contain the spread, which didn't make any sense at all. They were talking as though shutdowns were going to keep it from spreading, and and that is that's just unbelievable, that they would think that. There's no way you're going to contain the spread of a virus. You're not going to contain it, at least to the point where it's going to die out. Um, once it's out to that level, once it's out to a pandemic level. So the argument that was made was that, oh, well, we're going to shut down as though to contain it, not because we think that we're going to actually kill it off by containing it and isolating it, because we know that can't happen. We're doing it so as not to overwhelm the healthcare system. And that made sense to me at the time, until I realized that our hospital and a decent number of the city's hospitals were by and large empty. Um, and that we had a lot of resources. They built a field hospital in one of the arenas downtown. They gave us a shipment of ventilators, as I recall. But those were all sent back. They dismantled the field hospital and sent back the ventilators because the reason given was that we didn't have any cases. So rather than opening up the economy and allowing people to carry on as per usual, they kept everything shut down. And I kind of lost confidence in the whole thing at that point, because it was unclear to me what the goal was in shutting everything down. But it was clear to me that it was not to prevent the overwhelming of the healthcare system, because the healthcare system was receiving enough resources to deal with whatever new influx of patients was coming in, but those resources were sent back, and the constantly promised influx of new patients and cases never appeared. And of course, it was chalked up as a victory. This is what we wanted. This is what we expected to happen. But that's not what was expected to happen. That's not what was wanted. And it didn't make any sense. And another odd thing is that even in the hospitals, even though the hospital was empty, you have so many replays of what was going on in Italy or in certain hospitals in New York, that everybody is scared and feels and acts as though the hospitals are full. So that didn't make any sense to me. And then I thought, well, I'm not an economist. I don't know what the results of shutting down a decent chunk of the economy will be, but it can't be good. You can't stop producing. You can't have people stay home and live off of government handouts or stimulus payments for very long before you run out of money, before you do some kind of lasting damage to your economy. And people's health is tied to the economy as well. They drum that into you in nursing school. They talk about the socioeconomic factors that contribute to health. How how long-term anxiety really affects your health, and they'll tie that to poverty and wealth. Say that poor people live in anxious conditions and therefore tend to die of or be affected more severely by the same conditions and diseases than the wealthy. Well, now they're creating a huge and nationwide anxiety, and creating impoverished and economically uncertain conditions. For what? The goal seems unclear to me. People seem to have this idea that if they shut down, the virus will just go away, or if we shut down, it'll go away until we have a vaccine. Well, little news to you, I get Medscape emails. I was reading one of them, and they were talking about the effectiveness of some of the vaccines that are rolling out and what a great news this is. And then they were talking about how people are misinformed, thinking that once they get vaccines, things will go back to normal. And they're saying, no, that's not going to happen. Masks and social distancing and all the measures we've been using up until now will still be required. And it just makes me think, okay, none of it makes sense to me as far as the decisions being made by the epidemiologists. But one concern I do have that doesn't require any sort of conspiracy at all. Epidemiologists are specialists. Their job is to ensure that a pandemic or disease isn't responsible for destroying the country. What they're not responsible for is if something else destroys the country. So from an epidemiologist mindset, if the country's on fire and people are starving and masses of people are homeless, but they didn't die of coronavirus, it's a success and they won. They did what they were supposed to do. And I see this all the time. When you have specialists, so say like our doctors, a doctor's responsibility is to make sure that they aren't the ones that are contributing to some ill effect in your life. So they'll tell you, oh, well, my recommendation to you is that you get this scan, that you get this study, that you follow up with this specialist, or that you take this medicine. And it's not the doctor's responsibility if the cost of the medicine, the time that you take off to see the specialist, or anything else disrupts your life to the point where you're out of a job, homeless, and worse affected by the condition than you would have been otherwise. That's not their job. They won't get in trouble if you become homeless, if you lose your job, if you become bankrupt through the cost of medicines. That's not their problem. They won't get in trouble if your life is destroyed for one of those reasons. They're only responsible for your health as it pertains to the condition that you came and saw them for. And so that's where their recommendations come from. That's the perspective that they're recommending these things to you. And they're not going to take into account your whole well-being as a human being with all the needs and situations inherent in human life. Their specialty is your physiological health. And so they're going to see to it that they are not at fault for any detriment to your physiological health. In the same way, an epidemiologist, like I said, if you die, if you end up getting depressed and committing suicide, if you end up losing your job and becoming homeless, you lose your business, you become depressed, you start eating too much, you become an alcoholic, if you suffer because that happens to all of your neighbors and a bunch of homeless people are roaming the streets and they're breaking into your house and stealing your things, they're not responsible for any of that. Even if it's the direct result of their recommendations, they're not responsible for any of that. If you don't die of the coronavirus, then as far as they're concerned, you're fine. So that's my thought regarding epidemiologists and why I encourage you to do some thinking for yourself and recognize that there are limitations. There are limitations to specialists and scientists and scientific advice, even if their data is correct. And and there's as much evidence for the universal correctness of scientific recommendations at any given point in history as there is evidence for the infallibility of the Pope. So even if you were to assume their infallibility when they give directions to the public, and if you want that to be the basis for public health measures and laws and societal restrictions, then recognize that their infallibility is limited, in that it's restricted to a very narrow sphere of operations that their discipline pertains to. So if you think that it's a win that you don't die of coronavirus and none of your family members die of coronavirus, but you're homeless and impoverished and submissive to a state that tells you that you can't meet or worship or buy or sell as you please without meeting all of their conditions. If you think that that's a good trade, then so be it. I don't think that's a good trade. And that's my thought as far as that part goes. I'll try and record some of my other thoughts addressing some of the other aspects of the events of this year